Fractures of the skull. We have finished burns. Let's move towards the fractures of skull. Skull fracture, remember, surface and base of skull fractures are different. In this, let's identify and understand the surface fracture. The linear fracture means it's like a kind of a line. It is also known as the fissure fracture and it is the most common type of fracture. The next is a diastatic fracture. Diastatic means sutural. It passes through the sutures. It's a sutural fracture. Depressed fracture means a part of the skull is being pushed inside. Sometimes a depressed fracture can produce the pattern of the weapon. When it produces the pattern of the weapon, it is called as the signature fracture. Okay, particularly with hammer. When a hammer is used, the pattern of the hammer can be produced and it is a depressed signature fracture. Comminuted fractures are intersecting fractures, right? So comminuted fractures are intersecting fractures. Pond fractures are seen in newborns, particularly when there is a instrumental delivery. Okay, instrumental delivery. Okay. Bullet produces two types of fracture. Gutter fracture is a bullet graze which affects only the outer table. Only outer table is scraped off. Only outer table is scraped off. Whereas a keyhole pattern is seen again with bullet, but here the pattern is like this. This is a keyhole pattern. One small and a one big hole. This is keyhole pattern. Pappé's rule states that when there is one fracture line that's already there, the second fracture line cannot cross the first fracture line. Because, see, the energy is coming, but then there's a gap, it gets dissipated. That's all. So that is Pappé's rule. Now let's understand beveling over here, because in keyhole we have seen beveling. If this is our skull, okay, outer table and inner table, the bullet which is coming, right, this is going to be our entry. Remember, the outer table right now is supported by the inner table. The outer table is supported by the inner table. So when the bullet passes, the outer table will tend to produce a small round hole, right? Whereas the inner table would have got chipped off and will have a bigger hole. So when you look at the skull from outside, the hole will be very small. Whereas when you look at the skull from inside, the hole will be pretty big. This is out, this is inner table, which means this is entry. Whereas when the bullet is exiting, the opposite thing will happen. The inner table is supported, so it will have a small hole, whereas the outer table will have a bigger hole. Right? So this is a exit wound. Beveling of outer table is seen in exit. Beveling of inner table is seen in entry wound. Okay. So this is for bullet and injury. So let's just revise fast. Linear, also known as fissure fracture. It's the most common type of fracture. Diastatic fractures are sutural fractures. Depressed fracture at time can produce the pattern of the weapon. It is called as the signature fracture. Comminuted fractures are fractures which are like having multiple lines which are intersecting. Pond fracture happens in a newborn with instrumental delivery. It's more of a green stick fracture. So it's more like this indentation that happens. Okay, a indentation that happens. It's a green stick because over here the outer table fractures and over here inner table fractures. It's kind of a ping pong like. Okay, so pond fracture is also a ping pong like fracture. Gutter fracture, keyhole fracture, which are produced by bullets. Good question, Dr. Arul. Let's see the base of skull fractures. Okay, let's see the base of skull fractures. Yes. Take the question 44. 44 contains the base of skull fracture. Base of skull fractures are two mainly, ring fracture and hinge fracture. Ring fracture happens around the foramen magnum. If the center is the foramen magnum, this is a ring fracture. It is a indirect fracture. It is a indirect fracture. So when the person falls on the heel or on the buttocks, the force transmits along the spine and it pushes the spine into the skull cavity. So around the foramen magnum, there is a fracture. That is ring fracture. Hinge fracture separates the skull into two halves. Okay, so therefore, if this is the base of the skull is fractured in the middle over here. Okay, now this skull will function like this, like a hinge of a door. This is hinge fracture. Generally, the line of the hinge fracture will pass through sella turcica, right? So here you can see a hinge fracture. Here you can see a hinge fracture, right? This is type 1 hinge fracture, which is also called as the motorcyclist fracture. Okay. Type 2 will go from anterior to posterior cranial fossa, and type 3 hinge fracture is seen in anterior cranial fossa. Okay. So this is hinge fracture. Now, let's again go back to the previous page. Try to identify the fractures. What is this fracture? The first one. What type of fracture is it? Very good. This is linear. This is linear. The second, try to identify the second. Pond. Pond. Okay. Yes. Third. Third. Very good. Comminuted or intersecting fracture. Fourth. Very good. Gutter. Okay. Gutter fracture. Very good. Very good. Okay. Now let's look into intracranial hemorrhages. Okay. Let's start with our extradural hemorrhage. So we have seen it in our regular class. Just a quick recall. If this is the skull, okay. If this is the skull, here you have the dura mater, right? The dura is very closely adherent, and outside the dura, if you get a hematoma, this is called as extradural hematoma. This is EDH. And we have seen that the extradural hematoma is a very difficult to form bleeding because the skull and dura are generally close friends. They are thickly adherent. They will not separate. They are like this. Now to separate them, we need arterial pressure, which is where middle meningeal artery comes in. And when the middle meningeal artery bleeds, the vessels have bleeded, the dura and the skull will separate slowly like this, very slowly. That's why it's progressive and it will produce a spindle shaped hemorrhage. Okay, or a biconvex hemorrhage. This is a biconvex shaped hemorrhage, right? This is how it will look like in a CT. Okay, not only that, it has separated like this. To separate it, you need arterial pressure. So a artery gets broken when there is a fracture, right? So it's produced due to a direct trauma. So a direct trauma, breaking the artery, middle meningeal artery, you're going to get a biconvex, slowly progressive hemorrhage. Since it is slowly progressive, it produces a lucid interval. Head injury, patient becomes unconscious because of the concussion. He then gets up and starts walking, talking normally, right? Now the hemorrhage is slowly developing, becoming bigger and bigger. Patient suddenly collapses because the brain has herniated. Right? This is what is shown in almost all medical series, movies, right? And this is why we as doctors are also advised that head injury cases admit the patient for 24 to 48 hours and observe them, right? That's because of extradural hemorrhage. Okay, so extradural hemorrhage happens due to the rupture of middle meningeal artery, direct type of trauma. It is less common in children and elderly because the dura is very tightly adherent to the skull, associated with a fracture generally. Lucid interval is seen. Lucid interval is a period of consciousness between two unconscious period. Between two unconscious period. The hemorrhage is biconvex in shape. Then comes subdural hemorrhage. Subdural hemorrhage happens because of acceleration deceleration trauma. The acceleration deceleration trauma produces subdural hemorrhage because your subdural hemorrhage now is going to be below the dura mater but above the arachnoid mater. So here the hemorrhage is going to be, it is going to be, you can call it concavo-convex or convexo-concave, or you can call it crescent-shaped also, right? This is subdural hematoma. And this bleeds because from the brain, there are vessels which go to the sinuses. These are called as bridging veins. And these bridging veins, which are extended because of the acceleration deceleration trauma, they will break and produce the subdural hemorrhage, bridging veins. More common in elderly because the brain has atrophied, the vessels are becoming more and more calcified, and cholesterol is getting deposited there. Repeated fall produces chronic subdural hemorrhage. Okay, repeated fall produces a chronic subdural hemorrhage, concavo-convex in shape. Subarachnoid hemorrhage, which happens below over here, right? So because right now we would have our brain, right? This is our brain. So over here, the subarachnoid hemorrhage happens and it tends to be diffuse, extending everywhere. Okay. Berry is a natural cause of it, most common. Almost all trauma causes superficial head injury. Significant head injury causes superficial cerebral vessels to break and causes subarachnoid hemorrhages. Okay. So this is subarachnoid hemorrhage due to berry If they give a history of thunderclap headache, berry rupture. Where is the berry present? Circle of Willis. Okay. All right. Now, identify the hemorrhage. First hemorrhage is what? Check whether it's above the dura or below the dura. That's all. Check whether it's above the dura or below the dura. Very good. Correct, Dr. Arul. Yeah, good, Dr. Arul. Correct. You're right. It's above the hemorrhage, above the dura, extradural hemorrhage. What about the second one? Below the dura or above the dura? You're able to see a blue tinge below the dura, right? It is subdural hemorrhage. Very good. What about this one, third? What is the third one showing? It is again a subdural. It is a chronic subdural hemorrhage. Okay. So a chronic subdural hemorrhage tends to get encapsulated. A chronic subdural hemorrhage, because of the repeated trauma, okay, you can see areas of healing, which is like pale areas. Here you are able to see pale areas. And at the same time, there are areas of fresh bleeding also. Okay. So a chronic subdural hemorrhage tends to get encapsulated. It tends to get encapsulated. This is happening because the arachnoid is getting irritated repeatedly. So what it does is it produces a neomembrane and tries to encapsulate it. Okay. This is subarachnoid hemorrhage. This is subarachnoid hemorrhage. And here you are able to identify a berry aneurysm. This is a berry aneurysm. All right. Let's go to the next part. Cerebral hemorrhages. First, let's see the contusion. Site of trauma, the same site is containing the contusion, that is Coop injury. Same site of trauma. Okay. If you are finding hemorrhage opposite to the site of trauma, that is countercoup injury. It happens mainly on fall on the back. Okay. So the laceration is in the occipital region. But if you see the hemorrhage, it's in the frontal region. Okay. So if the trauma has happened over here and the laceration of the brain or contusion in the brain is seen in the anterior region, this is countercoup region. Okay. So this is opposite side of trauma. Coup and countercoup injury. Diffuse axonal injury. You have gray matter, you have white matter. Both are moving in acceleration, deceleration trauma. At their junction, because of the difference in their density, the axons will move at different phase, and there the rupture will happen, right? So that is diffuse axonal injury due to acceleration, deceleration trauma. This again, as Dr. Arul pointed out, acceleration deceleration trauma is seen in shaken baby injury, right? So shaken baby injury will have a subdural hemorrhage and diffuse axonal injury also, okay, along with brain edema. Then multiple petechiae are seen at gray white matter junction. Corpus callosum. Corpus callosum is the structure that's connecting the right and the left hemisphere, right? So a rotational trauma will produce a hemorrhage there and a brainstem hemorrhage, right? A brainstem hemorrhage. Commotio cordis in the heart. Commotio cordis happens in the heart. So you see sports person playing nicely, suddenly a trauma to the chest, collapses and dies. That's commotio cordis. So what has happened? A blunt force trauma to chest. Blunt force trauma to chest. To chest. That is commotio cordis. Particularly in the QRS complex, it hits, cardiac arrest happens. Then transportational injury. Transportational injury. Pedestrian injury. Pedestrian injury can be primary impact, secondary impact, or a tertiary impact injury. Let's learn it with Brownie again. Walking on the street, hit by a vehicle. So, first hit happens by the bumper, right? The bumper hits the lower limb. So, once the bumper hits the lower limb, the primary injury has happened. Now, the brownie falls on the bonnet. Secondary injury. What hits the bonnet? The head and the chest happens, right? The head and the chest hitting the bonnet, producing the secondary impact, right? Then brownie is thrown onto the street, producing tertiary injury or secondary injury on the road. Okay, tertiary injury or secondary injury on the road. So you have a primary impact, which is a bumper fracture of the lower limb. Then secondary impact, which is happening on the vehicle, the bonnet, windshield will produce it on the head, chest, and then the body is thrown on the street, right? So this is pedestrian injury. This is pedestrian injury. Then we have vehicular occupants injury, wearing a seat belt, right? Vehicular occupant injury is produced by the seat belt and then of course by the mirror and the glass and the steering wheel, but mainly the seat belt. The seat belt injury has a triad, particularly the lap belt. Abdominal wall injury, hollow viscera gets injured, and major vascular structure injury. This is a triad. So what is there in the abdomen? The abdominal wall, the hollow viscera inside, and major vessels injury. Then we have sparrow fit, the shattering glasses on the side. Which side the person is sitting, that side the glass shatters, and the shattering glasses will produce small superficial cuts, right? This is sparrow foot mark. Look at these mark. Don't they look like as if the sparrow has played on a, you know, sandy region. So if you see the sparrow's foot mark, it will look like this. Okay. Then the whiplash injury. That is why we are having headrest to prevent whiplash injury. The extension, hyperextension and hyperflexion, right? That produces cervical spine injury. That is whiplash. Remember, whiplash is seen in occupant of a vehicle. Okay. It has nothing to do with the whip. Then we have ladder tear. Again, the body is moving at such high velocity, the aorta, which is holding the heart, which is hanging there, gets torn. So there is multiple transverse tears in the aorta. Multiple transverse tears in the aorta. Now, when they give you injuries like this, try to identify what is this fracture in case of road traffic accident indicate. What does it indicate? Put it in the chat box. You see a fracture like this. Very good. A bumper fracture. A bumper fracture. Very good. The second one, what does it indicate? The second image, what does it indicate? Seat belt injury. Can you tell me whether it's a driver or a side occupant? Seat belt. Very good. In India, it's going with driver. Okay, so this is seat belt. All right. The third injury. Third injury on the hand, multiple right side, small cuts that you're able to see. Sparrow foot. Yeah, these are on the hand, right? Okay, in center it's tracheostomy they have done. Ignore that. The injury is sparrow foot. Yeah, sparrow foot. All right. Okay, let's go to the next page. Torture. Positional torture. Look at the image, you will be able to understand the positional torture. Torture also comes in MCQs along with torture declaration. The last declaration that they have asked is Oslo. Last year only they have asked it. Oslo declaration they have asked. Okay. So let's look at the position first. Here you have parrot, perch. Pirates of Caribbean. Johnny Depp used to be carried in this post many a time, right? This is parrot, perch. Parrot, perch, a form of torture. The second image shows wooden horse. So they are made to sit on a rod-like structure. And if you observe closely, there is weight tied to the leg, right? To pull the leg, causing severe pain in the genital region. This is wooden horse. This is wooden horse. The third is hog tie. After an incident that caused worldwide attention, this question was also asked. Just in the last 2 years, they have asked this hog tie. What is this position? Then we have tiger bench. See, in tiger bench, observe this. They have tied the thigh and the leg to the stool in which the person is sitting. But they have also added a wooden part, right? A brick below the ankle. So what happens? There is extension that's happening at the knee joint, right? There is an extension that's happening at a knee joint. So this is tiger bench producing severe pain. Producing severe pain, right? All right. Then we have declarations. Let's look at the declarations. Declarations are easy. Geneva means Hippocrates oath, ethics. If they ask ethics, if they ask Hippocrates oath, it's Geneva we are talking about. T for torture. Tokyo, Hamburg, Istanbul Protocol, they all came in for torture. The declaration is actually the Tokyo Declaration. Okay. Helsinki, H-E, human experimentation. Helsinki, H-E. Oslo, O for abortion. Malta, hunger strike. Malta is hunger strike. See, I remember it as hunger strike produces malnutrition, Malta. Okay. Sydney, brainstem. Yes for brainstem. Venice, terminal illness. Okay, Venice, terminal illness. And the last that's put in the website of WHO is the Astana. Okay, 2018 it happened, primary healthcare related. They spoke about primary healthcare. Okay, so ethics, Geneva. T for torture, Tokyo. HE, Helsinki, human experimentation. O, abortion. Hunger strike, malnutrition, Malta. Sydney, brainstem. Venice, terminal illness. Astana, primary healthcare. Okay, Astana, primary healthcare. Next, other forms of torture. Beating a person, right? Beating a person, this has come as match the following. Okay, they have matched it with beating and postures and sexual asphyxias. But match the following. Ear is beaten, ear is contused. We are talking about telephono, ear, telephono. Whereas leg is beaten up, the soul is beaten up. Falanga, bastinado. Okay, it is called as falanga or bastinado. Okay. Then we have wet submarine and dry submarine. Keeping a person down, cloth on his face, pouring water continuously, right? That's wet submarine. Dry submarine is when they tie a paper bag around the neck. That is dry submarine. Sexual asphyxias. Sexual asphyxias can be by inserting anything into the vaginal, oral, or anal canal. When they use a hot rod, it is called as the black slave. To keep the cattles on straight line, or dogs and all, they use a prod which is having a electric current at its tip. That is called as the cattle prod. This cattle prod can also be inserted into the vaginal canal. Hyderabad goli, where at the tip of a rod chili is smeared and then entered into the vaginal or anal canal. That's Hyderabad goli. And last, irritants or insects can be used. So these are other sexual forms of torture. Based on the names, match the following they have asked. Okay. Now, image, can you tell me what is the, sorry, image, can you tell me what is the image that's given? The first one. The first one, what is the image? Telephono, very good. Telephono. The second one, Falanga, very good. Second is Falanga or Bastinado, very good. Falanga or Bastinado. All right, let's go to the next part. Sexual perversion. What is the sexual perversion that's shown in the image? Looking at it, can you know the names also now? Can you tell us what it is? Very good. Eonism or transvestism. Eonism or transvestism. Again, these have also come as match the following mainly. Okay. They have come as match the following. Once image based question they have asked. Okay. Eonism or transvestism, where there is cross dressing, particularly the undergarments. Okay. So the terms we know, sadism. Sadist means someone producing pain on another, right? Sadism. Masochism, they produce pain on themselves. Masochism is producing pain on themselves. Fetichism. Fetichism is like abnormal stimuli or an object, right? Like any material, like a chudidar or a brazier or any inanimate object, if they use rock or anything like that, that is called as fetichism. Forturism, see, if there is R, remember rubbing, because students get confused between fetish and forturism. R means rubbing, contact with another person. Rubbing another person produces sexual gratification. That is called as forturism. Voyeurism, the other name for voyeurism is scotophilia. Scotophilia. So, scoptophilia means voyeurism, peeping Tom. Okay, seeing a person in a private, either when they are in their restroom or in their bedroom, right? So that is scotophilia, voyeurism. Then exhibition. The person gets sexual gratification by exposing themselves in public places. Okay. Exposure produces sexual gratification, that is exhibition. Then transvestism, remember the name eonism, because this time they have used eonism. Satirism. Satirism is excessive sexual drive in male, whereas the excessive sexual drive in female has come as nymphomania. Okay? Nymphomania. These are sexual perversions, or the other name is paraphilias. Okay? Paraphilias. All right. Types of hymen. In hymen, image based question has come. This is the image that they have given. What type of hymen is this? What type of hymen is this? This is the image they have given. Very simple, very good. Septate. This is septate. Okay. This is septate. All right. The types are imperforated. Okay. So it is not perforated. No hole is there. Imperforated. Okay. Then it can be annular, which means it is just round, right? It can be fimbriated. Here you are able to see like fimbriated. Yes. Then it can be cribriform. Cribriform means small dots are there. Holes are there. Like cribriform plate of ethmoid bone. Small holes are there. Okay. So these are the major types. Apart from it, they give crescent shaped, right? Or lunar shaped, seen occasionally. All right. The rupture for forensic, the rupture. 5 o'clock to 7 o'clock. So when you examine, if this is the anterior part and this is the posterior part, we say 12 o'clock is on the top, 6 o'clock is down. This is 11 o'clock to 1 o'clock, which means anterior. And here is 5 o'clock to 7 o'clock. Posterior clock position generally indicates sexual offense. 11 to 1 indicates generally trauma. Again, need not be a rule. It's not a rule, it's just a general indication. Okay. In children, the hymen is not torn always, though they might have massive contusion, posterior faucet is torn. They might not have a ruptured hymen because the hymen is pretty deep seated. Hymen is deep seated. Geister keen rod. It's a rod like it's slightly bent rod. At the tip, there is a bulb. Okay, it's a glass rod. So what happens is when we have to examine the margins of the hymen, like here, we want to examine this margin. This rod is inserted and then it's slightly pulled back, retracted. So the margins I sit on the glass and you can visualize it. Okay, so it's used for examining. So we have to know what is the term false virgin. False virgin means they have had sexual intercourse, but still the hymen is intact. Okay, they have had sexual intercourse, but hymen is intact. What are the reasons for it? The reasons for it are one, they could have had a surgery. The other, the hymen was very elastic. Or in case of children, it was very deep seated. Okay. All right. Then we come to maceration. We've come to intrauterine death. Maceration. Maceration is nothing but aseptic autolysis. Aseptic autolysis. Maceration indicates intrauterine life, death. Intrauterine death. So, intrauterine death means the baby has not taken the breath. Respiration has not happened. So the diaphragm is pretty high. It is at 3 to 4 rib. We can examine the diaphragm by placing the finger via the abdominal cavity. Okay, not from the top. Because when you examine from the top, we might push the diaphragm down, right? Let's say this is the dome of the diaphragm. You do like this, you're going to push it down. So what we do is we come from below and we slightly examine what level it is. Okay. So diaphragm is examined from the abdominal side. Then lung. See, when the child respires, air goes in. Along with the air, there is also blood going in. So a respired lung is heavier. Remember that a respired lung is heavier. A non-respired lung is not heavy. A unrespired lung is about 35 grams in weight, both lungs together. Remember the word S, lungs. Both lungs together, it's about 35 gram in weight. It is reddish brown in color, very sharp margin. And when you take a piece of the lung, squeeze it, put it in water, it will sink. That is called as Raget's test. It is also called as the hydrostatic test. This test is also called as the hydrostatic test. Okay. But remember, this test is not foul proof, which means you can get a false negative. False negative means, see, positive means the lung is floating. False negative means the child is born alive, respired, but despite that, the lung is not floating. What could be the reasons for it? The reasons could be as simple as pneumonia, right? Atelectasis, hyaline membrane disease, right? So here, though the child was born alive, respired, the lung sinks. Acute respiratory distress syndrome, edema, all of these will cause the lung to sink. Then, when you look at the abdomen, there is no air in the stomach. Okay, there is no air in the stomach. That is Bruslow's second life test or Bruslow's test. Middle ear, when the child cries, middle ear will contain air, right? That will also not be there. Okay, middle ear is also not containing air. Apart from it, as time passes by around half a day, that is 12 hours, air is there in the great vessel. Decomposition gas is forming in the great vessel. This is called as Robert's sign. Not only that, as days pass by, the brain matter no more having pressure, getting liquefied, the brain collapses and the skull bones tend to overlap. Overriding of the skull bones. So here you can see, instead of being as a proper, if you see the proper skull bone, it is supposed to be like this, right? Though they are not fused, they should give a structure. Now here you are able to see overriding. They are just in a random way like this. This is Spalding sign. Overriding of the skull bones. Mummified baby, if it is delivered, it's more than 2 weeks. Mummified baby means it's more than 2 weeks. Okay. Now here in maceration, let us remember the opposite will be seen in case of live birth. In case of live birth, the diaphragm will be around 6 to 7. Lung will be nice pink, but it will be heavy because the blood has gone inside. So it will be around 70 grams, both lungs together. It will float, right? It will float. But again, not all floating lung means that the child has respired. You can also get false positive. So when do you get false positive? You will get false positive when there is artificial respiration. Child was born dead, but then we pumped more and more air that can produce it. The second is decomposition. See, decomposition, it's easy for us to differentiate because we take a piece of liver also and put it under water. If the liver also floats, it means it's decomposition fluid, air. Okay, so that we come to know easily. If the child has respired, air will be there in the middle ear, air will be there in the stomach, vessels and all are good. Definitive sign of live birth. Definitive sign of live birth. Mainly two things: milk in stomach and umbilical cord undergoing changes. So if you find the umbilical cord as dried, writhed, and fallen off, that indicates that the child was live born and survived for few days, right? So that is definitive sign of live birth. Also, since we are here, let's also remember it is a general dictum. This is the dictum, okay? When you're opening a body, the skull is first opened, or you can say cranium is first opened. Okay, and neck last. Particularly in asphyxia, neck has to be last. Also, in case of fetus and newborn, okay, abdomen before thorax. This is the rule. Cranium is always opened first, neck is always opened last. In case of fetus and newborn, the abdomen is always opened before the thorax because we want to know the level of the diaphragm. Okay? All right. Let's see the age of the fetus. Age of the fetus to know, there are two rules mainly. Very simple rule, very easy. You get the complete length of the fetus. You apply Hess rule. If the fetus is less than 5 months, okay, or I would say if the fetus is less than 25 centimeter, apply Hess rule. What is Hess rule? Age in month is nothing but the square root of the craniocaudal length. If you get the length more than 25 centimeter, apply Morrison rule. Morrison rule says that age of the fetus is nothing but the craniocaudal length divided by 5. See, when we say craniocaudal over here, we are saying about the heel. Head to heel, crown heel length. Okay, we are talking about the heel divided by 5. All right. Now, let's give you some exercise. Child is 30 centimeter long. What rule will you apply? And what is the age of the fetus in months? Very good. 6 months. And what rule? Morrison. Very good. Morrison you applied. 4 centimeter. Child is 4 centimeter. Child is 4 centimeter. Hess rule. And what is the very good 2 month fetus? Okay, so sometimes in question, instead of giving months, they would have given weeks. Just pay attention to that and answer. Okay, some instead of giving 2 months, they would have given 8 weeks. Okay, so if they have given 8 weeks, then 8 is the correct answer. All right. Okay, medical negligence. Oh, before we moved, ossification center. Sorry, let's see the ossification center also. The first ossification center, clavicle. First ossification center is clavicle. Okay, it up happens at around 4 to 5 weeks, almost a month. 1 month, the child is already having a clavicle, first ossification center. The second is maxilla. Okay, the second is the cheek maxilla happens by around 6 weeks it will happen. Okay, then we have certain rules. See these region, you see this calcaneum, manubrium, the lower end of femur. We open the chest of the fetus, sternum we examine, right? So the manubrium and the sternal body. We just flex the knee of the child, not the elbow, the knee of the child, and we give a incision in the knee region. Okay? Lower end of femur, upper end of tibia, we are able to examine. Ankle, we flex, give an incision at the heel, we are able to see calcaneum and talus. Okay, so that's how we do it. Once you know that, it's easy. Now, in the heel, when we cut, it is C5, T7, calcaneum 5, talus 7. Okay, when we cut the knee region, the lower end of femur, 9 months, the upper end of tibia, slightly later, a week or two later, it will come. So, more than 9 months. Now comes the sternum. See, sternal body has 4 parts. And then you have manubrium sterni. Okay? Each will have its own ossification center. We cut it in the midline and we fold it and we examine it. In an X-ray, ossification centers are radio opaque. Whereas in a fresh dissecting body, these ossification centers will appear as red dots. They will appear as red dots. Now, if you take the sternum, including the manubrium, the appearance is 5, 5, 7, 7, 9. 5, 5, 7, 7, 9. Now, do the exercise, you will understand it. See the first X-ray. Tell the age of the fetus from this X-ray. Try to tell the age of the fetus from the X-ray. Morning you did adult, right? Like now try the fetus. Age from... Okay, can you tell us more than 7 or less than 7? Become more specific. More than 7, because you're going to tell whether the fetus is viable or not viable. 7 months, 28 weeks. More than 7. Very good. So this indicates more than 7. This is calcaneum. This is talus. Right? Very good. Okay, let's try this X-ray. Try this X-ray. More than 9. Very good. Which means we are more talking about a term fetus, right? We are talking about a term fetus. Okay, this is the chest, okay, which has been cut open. Can you tell us the age from the sternum? Can you tell us the age from the sternum? Very good, Dr. Bhavadharini. Very good. It is, you can, sorry, you can make it out over here. 5, 5, 7, 7. These centers which have come over here. Right? It is one center only. We have cut it in the middle and just folded it and opened it. Okay. So it's more than 7 months. Yeah. Very good. Very good, Dr. Monisha. Very good. Okay. Next, medical negligence. So this, they have given image-based question and they have said which principle applies over here. Okay. This is a case of, what is it? It is a case of res ipsa loquitur. Very good, doctor. Res ipsa loquitur. Fact speaks for itself. A scissors inside the abdominal cavity indicates that there is negligence. The patient need not prove anything over here. He just have to show the X-ray. This is my abdominal X-ray that was taken. Look at it. Okay. So this is a res ipsa loquitur. Okay. Let's see burden of proof over here and defense against medical negligence. See, when we designed this book, we have designed that image-based questions are kept over here and few topics related to the image-based questions. Topics which are not here, okay, but have come in the exam, have either been covered in the one-liner or in the strategy. Okay, so the theory topic, like right now we have not seen sections, we have not seen the legal procedures, and along with it, even in medical negligence, the informed consent and the types of medical negligence, we will see it in the next part. Okay, so we will see it in the next part after the image-based questions. Okay, so here we have burden of proof of negligence. It is always that the patient has to prove negligence. Okay, so patient has to prove negligent, except, the word except is the beautiful thing that they ask in MCQs, res ipsa loquitur. Fact speaks for itself. Wrong limb surgery, right? Leaving an object inside. Okay. Here the doctrine of common knowledge is applied. What is this doctrine of common knowledge? Layman can say it. That is doctrine of common knowledge. Okay. Defense against negligence, we have some, what do we call that as factual defenses. Factual means just by fact. It's been 2 years since the negligence has happened. Patient did not say anything, knew about it but did not say anything. Law of limitation has passed. COPRA, Consumer Protection Court. It's been more than 2 years. If they have not filed the case, they cannot file the case. But if it is within 2 years, they can file the case. Next, res judicata or double jeopardy has been tried already. Okay. So until there is some new discovery, if a case has already been tried once and has already been closed, they cannot reopen the same case again. That is double jeopardy, res judicata. Okay. Next, vicarious liability. Superior is responsible. Okay. Now, vicarious liability works only in civil court. When there is criminal negligence, doctor cannot go and say that my senior is responsible. In criminal negligence, even the junior is responsible. Medical misadventure or therapeutic misadventure, every procedure has its own risk. Here, if you have taken a consent, you have said to the patient very clearly that this can go wrong, then it can always go wrong. Okay, and it's agreed. Next, calculated risk doctrine. Calculated risk doctrine means the doctor did know about the risk of this procedure. You saw the risk and you also saw the benefit, okay, or the good it will do to the patient, and you took a call. You took the consent. Calculated risk doctrine. Volunteer means volunteering, which means the patient gave consent. Voluntary non-fit injuria means the patient did give consent. Novus actus intervenus, intermediate act. You sent the patient, ambulance met with an accident. Right? So though the doctor who has seen the patient first has been negligent, if there is an intervening act, that becomes novus actus intervenus. Like for example, a doctor prescribed a wrong medicine. Patient now went out, okay, bought a completely different drug from another pharmacy, okay, and then got it injected. Novus actus intervenus. Now the pharmacist is also involved there. He gave a drug which is not prescribed by the doctors, right? That's novus actus intervention. Classical example is ambulance met with an accident. Okay, ambulance met with accident. Then patient negligent. Patient was negligent. You told the patient to take these medication. Patient did not take the responsibility. He didn't take the medication. Patient is negligence. Contributory negligent. Patient was also negligent, which means you told the patient, I have done the dressing. You come to me for dressing. Patient was at home. He did the dressing of his own, right? Contributory negligence. You put a slab or a cast tight. You knew it was tight, but you told the patient if there is numbness, tingling, and everything, come to the hospital. Now, patient comes only when the fingers are gangrenous. Okay, so here it's a contributory negligence. Again, only in civil court it can be used, not in criminal courts. Majority of these defenses you can't use it in criminal courts. Okay, corporate negligence means that the hospital, or in case of product liability, the manufacturers are responsible. Okay, the manufacturers are responsible. So that's corporate negligence. Yes. So these are the defense against medical negligence. Remember the name: res ipsa loquitur, law of limitation, res judicata or double jeopardy, voluntary non-fit injuria. Okay, voluntary non-fit injuria. Okay, all right. Let's start with poison. Let's do the general poison, the first page alone. Then we will take a break. Okay. They give an image. This is meiosis. We should know the drugs which causes meiosis and mydriasis. Again, unlike ophthal, we are not going to go into the depth of it. More important questions that have come in forensic alone. Meiosis. like seepoda pallu madri, like the tooth of the comb, right? They are all pinpoint, right? COMB. C for carbolic acid and chloral hydrate. O for organophosphate, right? And also O, remember opium also. Opium and OPC. See, the derivative of opium, morphine, right? So it includes your morphine also. And muscarinic agent. OPC, right? Muscarinic. B for barbiturate. Comb. Okay. COMB. Okay, comb. Next, mitriasis. Amphetamine. Here you remember it as A, B, C, D. Amphetamine, belladonna, atropa belladonna. C for cocaine. See, cocaine causes dilated pupil. Okay, whereas carbolic acid and chloral hydrate produces pinpoint pupil. Okay, datura. Datura contains nothing but atropine. A, B, C, D. All right. Now, let's look at antidote. Let's have a quick revision into antidote. Few of the antidotes which have been commonly asked are mentioned over here. But this time they asked one more thing extra. Uh, remember methylene blue. Okay. Remember methylene blue also. Okay. It is also an antidote. Okay. Atropine, physostigmine, organophosphate. We can give either atropine or pralidoxim. Ethylene glycol, it is fomeprazole or ethanol. For us, for methanol, it is ethanol or fomeprazole. Remember, this has come as MCQ also. Methanol will not be used as antidote. Ethanol is the alcohol that is consumed. Okay? It is consumed legally in India, so it can be used as an antidote. But methanol is responsible for all the Hoonch tragedy. We will see it inside also. But remember, methanol is responsible for all the Hoonch tragedy, the blind eye. So one day you get up and read in the newspaper, this many people died due to illicit alcohol or illegal alcohols, and this many people lost their eyes, right? And in local newspaper, they write it in a very dramatic way. So that's methanol. Okay. Opioids, naloxone, nalmefene, and nalorphine. So opioids, naloxone. Benzodiazepine, flumazenil. See, fomepizole, O for alcohol, OH group, right? Flumazenil, benzodiazepines. These are just for you guys to not to get confused. Okay, forturism, R, rubbing. So these are for not to get confused. Paracetamol, N-acetylcysteine. Digitalis, digibind. Cyanide, hydroxycobalamin, sodium nitrate, and sodium thiosulfate. Right? You're producing methemoglobin and then you're giving sodium thiosulfate so that cyan thiosulfate is coming out. Right? Yes. Then you have stomach wall. What is a poison? Looking at the color, can you tell me what poison is this that we have dissected out? Can you tell us what is the poison? Very good. It's sulfuric acid. The black is because it has carbonized the tissue. It has carbonized the tissue. Whereas nitric acid, picrate, right? We saw spermine picrate in the morning, which is more of yellow in color. Methylene blue, good doctor, you've asked. Methylene blue you use for anything that's containing industrial agents, anilins, nitrates, right? So all of these you're going to use methylene blue. Okay, so the reducer substance, someone drank a reducer and came. Those you use methylene blue. Nitrates. Okay, then blue, greenish blue, copper sulfate. Copper sulfate itself has the color of blue and greenish blue. Okay, once they have asked uh, amital sodium. Okay, so the tablets which are blue in color, because of the dye that is there in them, will produce a blue color. Okay, but copper sulfate itself is a compound which is blue. So actually, blue means it's copper sulfate that we are thinking about. Red velvety stomach, arsenic. Okay, sulfuric acid is nothing but a battery acid. Remember that sulfuric acid is a battery acid. HCl is a toilet cleaning acid. Okay, whereas floor cleaning, we will be studying it again, but since we are seeing it here, let's see it together. Full floor cleaning is nothing but phenol. Phenol is nothing but carbolic acid. Okay, and ink remover is oxalic acid. Ink remover is oxalic acid. All right. So here we have seen ink remover is oxalic acid, carbolic acid or phenol is also a floor cleaning acid. Now, let's look at these features. Oxalic acid produces hypocalcemia. See, forensic medicine, hypocalcemia, remember three things. One, oxalic acid. Two, hydrogen fluoride. Three, ethylene glycol. See, ethylene glycol itself will produce oxalic acid. That's why it's producing hypocalcemia. Okay. See, calcium oxalate crystals will be there. Renal failure will happen. But if your question is containing calcium oxalate crystal, renal failure, patient drank a ink eraser, produces with all the Chaustick stain, right? Trousier's sign. Think about oxalic acid. Whereas in carbolic acid, they will give you a urine sample which is becoming more and more black in color on exposure to air. It is green, going towards black. It is carboluria. That's because of its metabolites, hydroxyquinone and pyrocatechol. Carboluria, green to black urine. Okay, one. The second thing is ochronosis is seen, which means there is a deposit, a black, greenish black deposits which happening in the cartilage and sclera. Boric acid, boiled lobster appearance. Boiled lobster appearance. Okay, now if they have given you this image, what is the poison that you will suspect? If they have given you this image, what is the poison that you will suspect? If they have given you this image. Very good. Oxalic acid. Any other? Two more. Ethylene glycol and hydrogen fluoride. Very good. Very good. Okay. So we will take a break now and we will continue further after the break. Okay. Thank you. 5 minutes break. Okay. Just a 5 minutes break.